Hi guys, this is chapter 14, pharmacology and medication administration. Alright, we're going to learn about administering medicines, medications you can commonly administer, the names, routes, medication forms, essentials of medication information, key steps in administering it, reassessment, and sources for medical information. EMT Nate quickly approaches the patient and sees that the patient, who is sitting on the ground leaning forward to support himself with his hands, is in respiratory distress. The patient, a teenage boy, does not acknowledge his presence and appears pale and sweaty. "Hurry," exclaims the woman kneeling next to the boy. "He's allergic to bees. He was stung by a wasp. I don't know how to use his epi injector." Alright, what's your initial impression of how serious the patient's condition is? Alright, he's sitting kind of hunched over in that tripod position, and I'm thinking it's, pretty serious. How is epinephrine beneficial to a patient with a serious allergic reaction? Well, it can actually reverse an allergic reaction like this. And what would you need to know about epinephrine before administering it? All right. You need to know a lot of things about the medicines that we give. All right. Not only the dosage, but how we give it. Because once you give something, you can't take it back. All right. All right. We administer or assist in the administration of medications. As an EMT, you will be responsible for administering or assisting the patient with the administration of certain medications. Unlike a mathematician, you can't erase your mistakes and start over. Once a medicine has been administered, you can't extract it or prevent the effects that it has. So what exactly is a drug? A drug or a medication is a chemical that is used to treat or prevent a disease or condition. The study of drugs is called pharmacology. And EMTs, it is common for them to carry certain medicines on a truck. A medication is generally defined as a drug or other substance that is used as a remedy for illness. A drug is a chemical substance that is used to treat or prevent a disease. The term drug and medication are often used interchangeably, and the study of drugs is referred to as pharmacology. All right, when the correct dose is administered appropriately, the patient's condition may improve significantly and uncomfortable symptoms may be relieved. If administering appropriately, some drugs can cause serious side effects. Inappropriately. Some drugs can cause serious side effects, and it can even cause deterioration of your patient. If the order allows the EMT to admit medication administration, the EMT will obtain the aspirin, and then the EMT will place the aspirin in the patient's mouth. If the order allows only patient-assisted medication of administration of aspirin, the EMT will obtain the aspirin and instruct the patient to chew the aspirin, and the EMT will hand the patient the aspirin tablet and have the patient place the aspirin in their mouth. Medications that EMT administer are either carried on the EMS unit or are prescribed to the patient. The prescription medication may be found on the patient or at the scene. It has become more common for EMTs to carry most or all of the medicines they are able to administer on the ambulance. It is extremely important to become completely familiar with your local protocol, as this dictates not only the medicines that can be administered, but the specific dose and routes, but also which medicines the EMT can administer and which are to be patient-assisted administrations. Oxygen is one of the medicines that we can give. It's an odorless, tasteless, colorless gas that is found in the ambient atmosphere at a concentration of approximately 21%. When it is used for medical purposes, it is administered as a 100% compressed gas concentration. So, by increasing the oxygen concentration breathed in by the patient, you attempt to put a higher concentration of oxygen into the alveoli of the lungs. By doing so, you increase the amount of oxygen crossing over from the alveoli and into the pulmonary capillaries. In healthy individuals, high concentration of oxygen has been found to reduce cardiac output and left ventricular perfusion, which reduces systemic and coronary artery blood flow. In patients with heart disease, Hyperoxia, which is a high oxygen levels, leads to coronary artery vasoconstriction and a higher coronary artery resistance, thereby reducing coronary artery blood flow to the heart muscle. This can lead to a reduction in cardiac output, cardiac ischemia, and possibly life-threatening cardiac arrhythmias. In the patient with a medical condition, if the breathing is adequate and the SpO2 is 94% or greater and no other signs of respiratory distress, hypoxia, hypoxemia, or poor perfusion are present, there is no need to administer supplemental oxygen. If the SpO2 is less than 94% or signs of respiratory distress, hypoxia, respiratory distress, hypoxia, hypoxemia, or poor perfusion are present, initiate oxygen therapy via nasal cannula at 2 liters per minute and titrate to maintain an SpO2 reading of 94% or greater. If signs of severe hypoxia are present, a normal breather mask at 15 liters per minute can be used. In the patient with a traumatic injury, especially one involving the brain, thoracic organs, or spinal cord, or one in which there is evidence of respiratory distress, hypoxia, hypoxemia, or poor perfusion, or when the potential exists for significant bleeding or shock, the American College of Surgeons recommends the delivery of high concentration of oxygen to achieve and maintain an SpO2 of 95% or greater. This is typically achieved through the use of a normal breather mask set at 15 liters per minute. If bag valve ventilation is being performed on either a medical or a trauma patient, regardless of the condition or the injury, high concentration of supplemental oxygen must be delivered. Oral glucose is absorbed in the mouth and through the intestines and eventually into the blood, where it raises the blood glucose level, making more glucose available to the starving brain cells. The brain cells will once again begin to function normally. This is seen as an improvement in the patient's mental status. Activated charcoal, once absorbed, the poison is carried by the charcoal through the digestive tract and then eliminated in a bowel movement. The efficacy of activated charcoal has been questioned, and it may have harmful effects if aspirated. Activated charcoal has been removed from many protocols. The administration of aspirin may keep the coronary arteries that deliver blood to the heart from completely closing. EMTs do not administer it for its analgesic or its pain-relieving effect. Inhaled bronchodilators are medications that cause the bronchioles to dilate. They contain beta-2 agonists that are topically deposited through the inhalation route on receptor sites in the bronchial tissue. When the beta-2 receptor sites are stimulated, it causes the smooth muscle to relax, leading to dilation of the bronchioles. This causes a decrease in airway resistance with a resultant increase in airflow and improvement of oxygen delivery to the distal alveoli. Most often, you will find metered-dose inhalers prescribed to patients with a history of asthma, emphysema, or chronic bronchitis. These patients have episodes of bronchial constriction in which the bronchioles in the respiratory tract constrict, increasing the resistance to airflow in the lungs and down to the alveoli. The patient experiences shortness of breath and signs and symptoms of respiratory difficulty from the increased effort to breathe and from the decreased flow of oxygen to the alveoli. Inhaled bronchodilators are medications that cause the bronchioles to dilate. All right, that's what we need to know. They have beta-2 properties. Beta-2 works on the lungs. Okay? With a small volume nebulizer, the indications, actions, side effects, and contraindications of the medication are the same as a metered-dose inhaler, only the route of delivery is different. For small volume nebulizers, the mask or the pipe thing that smokes, all right, it's usually what we give albuterol and like Duonex 3. Nitroglycerin is used to treat patients with disease of the heart that involves partial blockage or spasms of the coronary artery. The medication comes in a tablet or spray that is administered under the tongue or sublingual. Nitroglycerin dilates the blood vessels in the body, causing a reduction in systemic vascular resistance. This reduces the workload of the heart by decreasing the force of contraction necessary to eject blood against the lower blood pressure in the aorta. The reduced myocardial workload results in decrease in the heart's muscle demand for oxygen. At the same time, nitroglycerin's vasodilation of the coronary arteries themselves increases the supply of oxygenated blood to the heart muscle. Because the major side effect is hypotension, it's important to measure the blood pressure both before and after administration of nitroglycerin. And nitroglycerin is not selective. It dilates all arteries and vessels, okay? Epinephrine constricts the vessels. It has alpha-1 and alpha-2 properties, increasing the blood pressure. It dilates the bronchioles, beta-2 properties, allowing the patient to move more air into the alveoli and decreases capillary permeability, alpha-1 and alpha-2, which reduces the leakage of fluid. Depending on the dose and route of Narcan and the opioid that the patient overdosed on, the opioid may stay in the body longer than the Narcan. Therefore, it may be necessary to repeat the dose of Narcan to continue to reverse the effects of the opioid drug that was taken. Excuse me. In addition, some opioids, such as fentanyl, are potent and may require several repeat doses of Narcan to reverse the respiratory depression, hypotension, and sedative effects. Narcan itself has no effect on a patient unless an opioid drug is currently in the person's system. Therefore, it's relatively safe to administer in either suspected or known heroin or other opiate drug overdoses. In addition, the EMT can administer it via several routes. You can give it intramuscular, subcutaneous, and intranasal. The most common you will see here is intranasal. All right, kneeling next to the patient, Nate can hear stridor and wheezing, and he detects a weak, rapid radial pulse. The patient is unable to speak. That's a bad sign. With a history of bee sting allergy, a witnessed bee sting, and signs of severe distress associated with anaphylaxis. Nate knows he must act quickly. Following protocol, Nate prepares to administer the epi auto-injector. What is the medication form that Nate's about to administer? Okay, we give this IM, which is intramuscular. By what route will Nate administer? The medication form is going to be a liquid. The route is going to be IM or intramuscular. What are the steps that Nate must follow in administering the medication? All right, this is going to be the 5 rights of medication administration. So let's talk about medication names. Drugs have the following category of names. Chemical name. The chemical name describes the drug's chemical structure. It's usually the first name associated with that drug. They have a generic name, also referred to as the non-proprietary name. The generic name still reflects the chemical characteristics of the drug, but in a shorter form than the full chemical name. It's the name associated to the drug before it is officially listed and is independent of the manufacturer. The generic name is listed in the U.S. Pharmacopoeia, a publication listing all drugs officially approved by the U.S. FDA. Trade name, also referred to as the brand name, is assigned when the drug is released for commercial distribution. The name is usually short and easy to recall, and many may be based on the chemical name or the type of problem it's used to treat. This is the name the manufacturer uses to market the drug. Then you have an official name. Drugs meeting the requirement of the U.S. Pharmacopoeia or National Formulary are given an official name. It's commonly the generic name followed by the initials USP or NF. All right, so here's examples of a chemical name, generic name, official name, or trade name. All right, here's some of your common generic and trade name of the medications that you will give. All right, you have oxygen, oil glucose, activated charcoal, nitroglycerin, spray or tablet, epi, auto-injector, albuterol will be an MDI. All right, ipratropium, Xopenex, aspirin, Narcan. All right, the route is how the medication is given or taken by the patient. The route affects how fast the medication is absorbed by the body and its effects. All right, if I give something IV, it's going to take effect in the body much faster than if I rub it on their skin. Each medicine the EMT administers is prepared in a form that allows for the quickest and safest absorption into the body. All right, most routes, or the most commonly the most common routes that EMTs give medication: sublingual, this is going to be your nitro. Oral, it's going to be your aspirin. Inhalation, it's going to be your metered dose inhaler. Intramuscular, your EpiPen. Intranasal, your Narcan, and SubQ, also Narcan. Sublingual, the medication is placed under the patient's tongue. The patient does not swallow medicine. It's dissolved and absorbed across the mucous membranes in the mouth. The drug usually has a relative quick absorption rate into the blood. The patient must be alert in order for you to administer the medicine in this manner. Only a limited number of medications can be given by the sublingual route. Two of those are nitroglycerin tablets and spray. Oral, the drug is taken by mouth or swallowed, also known as per os or PO. Except for activated charcoal, the medicine is typically absorbed in the small intestines. This is also known as an enteral route because it uses the digestive tract to absorb the medicine. The patient must be responsive and able to swallow. Some of the ones you're going to give PO are oral: aspirin, oral glucose, and activated charcoal. All right, inhalation. The medication is prepared as a gas or aerosol and is inhaled by the patient. This method typically deposits the medication directly to the target site where the effect is needed the most. The patient must be spontaneously breathing for this route to be effective. All right, medications the EMT administers using inhalation or oxygen, your metered dose inhalers, and your small volume nebulizers. The IM route, or the intramuscular route, the drug is injected into a muscle mass. The absorption is relatively rapid. This requires the use of a needle, therefore it poses the danger of a needle stick injury to the EMT. Some discomfort may be felt by the patient. Serious side effects might occur if the drug is accidentally injected into a vein. The medication can only be injected in specific muscle groups. All right? These are usually your big muscle groups, your thigh or your upper arm. Okay, those are your biggest muscles. Some of these are going to be your EpiPen, and Narcan. Okay. Intranasal. The medicine is sprayed into one or both nostrils using a specialized delivery device called a mucosal atomizer device, or a MAD, that is either attached to a syringe or built into the device. The MAD creates a fine spray of drug particles of a specific size. The fine particles stick to the mucosal lining in the nasal cavity, allowing for fast absorption onto the nasal capillaries. The capillaries then deliver the drug directly to the circulatory system. It has been found that this delivery route can produce effects that are sometimes similar to the medications being injected. All right? Medications you can administer using the intranasal route are Narcan and the Narcan nasal spray.